Chapter 11, Bulk Repackaging and Non-Sterile Compounding. I will skip past the terms and definitions as we'll cover them throughout the chapter. There is quite a few for this chapter, so just keep that in mind. Repackaging medications into single doses, known as bulk repackaging, and preparing patient-specific medication doses or formulas, known as non-sterile compounding, are two common tasks that we perform in modern pharmacy. Compounding may be done in a specialty or compounding pharmacy or in a community or retail pharmacy that provides this service. These pharmacies are equipped to prepare a wide assortment of solutions, ointments, creams, suppositories, and other drug delivery systems. Compounding pharmacies also prepare medications in various dosage forms and strengths for animals. So compounding was kind of how pharmacy started, and now we have drug companies that make bulk medication that we don't need to prepare in the pharmacy. But we do still do compounding. There's compounding specialty pharmacies. There's compounding pharmacies that just do compounding. So I mean, it's still done. It's just not done as much as it used to be. Institutional pharmacies often purchase medication in bulk quantities. These are large count bottles containing up to 1,000 dosage each that are sold at a much lower cost because of their size. The department employs technicians to repackage these medications into single doses, or what is commonly referred to as a unit dose medication, to save a substantial amount of money and to create an inventory of medications for the automated dispensing machines. These unit doses are dispensed to specific patients one dose at a time when they are needed for the physician's orders. This process is called bulk repackaging, and it can be done manually or by means of an automated system, transferring medications from a manufacturer's original container to another type of container before the need arises to dispense a prescriber's order. Prepackaged medications can be in unit dose, single dose, bubble or blister pack, or in a container used in a traditional dispensing system. One dose is referred to as a unit dose. Hospital use unit dose containers ordered from the manufacturers or make their own when necessary. Examples include unit dose packs or strip packs, and liquid cups that contain one medication for one dose. Nursing homes and home health care facilities may use blister packing or bubble packs, which may contain one to several tablets or capsules for dosing several days of medication. So these you should have in your lab kit. So you will get to practice doing that. Only one drug at a time should be prepackaged in a specific area. Label requirements include the proprietary and non-proprietary names, dosage form, strength of an individual dose, total contents delivered, beyond use date, and lot number. The following are 5 possible reasons a pharmacy may repackage bulk medication. Certain medications are not available unit dosed. The cost of repackaging bulk medications may be less than purchasing it unit dosed. Repackaging may allow the pharmacy to provide a patient with a new medication more quickly rather than having to order the drug and wait for it to be delivered. Labeling each individual dose reduces the chance of errors. If unit dose medication is not used, it can be returned to stock and used for another patient at a later time. So that part's kind of nice. And although packaging guidelines are not exactly the same between pharmacies and manufacturers, both must use good manufacturing practice. Good manufacturing practices are guidelines established by the FDA to guarantee safe and effective products for consumers. Table 11.1 shows examples of good manufacturing practice guidelines for repackaging. So for drugs and labels, they should all be checked by a registered pharmacist. The equipment should be in good and clean working condition. Beyond use date, you can see that I have this highlighted. That is 1 year from the date repackaged or the expiration date on the manufacturer's container, whichever is earlier, unless stated otherwise in the manufacturer's literature. Packages should be appropriate for the drug. In preparation, no more than one drug should be prepared at one time, and all items repackaged are logged for reference and records. Table 11.2 shows unit dose containers. So you can see the type of container in this column and the medication types and the volume size. And here is just a picture of all of those. So types of unit dosing equipment vary depending on the amount of drugs to be packaged and of course the size of the pharmacy and how many patients you repackage for. Sterile technique is not required for repackaging. However, technicians must observe the following rules for garments, techniques, and equipment to ensure that the environment is as clean as possible. Wear a lab coat, pull the hair back, wash the hands, wear a face mask when appropriate, wear gloves if the tablets or capsules will be touched, and use a pill counting tray and spatula if the tablets will be dispensed from the tray. To reduce cross-contamination of patients' prescriptions, pill counting trays should be cleaned after each use. If residue is left behind on the pill counter and the next patient is allergic to the previously counted medication, that patient may have an allergic reaction. When chemotherapy medication is counted, a tray marked specifically for counting chemotherapeutic drugs should be used to avoid cross-contamination. All trays should be cleaned with alcohol prep pads. Keeping track of the products you are repackaging is a major step that must not be overlooked. Just as manufacturers must document all drugs they have packaged, so must the pharmacy. If a manufacturer recalls a drug that has been repackaged, it is essential to have an accurate count of how many unit doses were made with the recalled product and to be able to identify them by the lot number on each. Table 11.3 shows examples of unit dose record log sheet information. So we're gonna, of course, have the date the drug is repackaged, which includes the day, month, and year, the drug name, usually by generic, and then brand if indicated on log sheet, the dosage form, tablet, capsule, spansel, troche, suspension, elixir, solution, manufacturer of the drug, usually abbreviated, manufacturer's lot number, manufacturer's expiration date, pharmacy lot number, pharmacy beyond use date, the technician, and the pharmacist. Table 11.4 is examples of manufacturer abbreviation codes. I never worked at a only compounding pharmacy, so I never have used these, but I guess if you work in a compounding pharmacy, you probably would use them quite a bit. And here is an example of the pharmacy technician is responsible for determining which drugs are needed to replenish the pharmacy stock according to periodic automatic replacement levels, PAR levels, and then preparing the necessary medications. Technicians must calculate the correct beyond use date, document the essential information, generate the labels, fill the medication, and then apply the label neatly on the container. In certain states, we have tech check tech, which allows a more senior technician to check a newer technician's work or whatever. So this is not allowed in every state, but certain states allow it, and it is limited to checking repackaged unit dose, floor stock, and patient medication drawers. Medications in a solid form, like tablets, usually have a longer shelf life than liquid forms because it's easier for a liquid product to degrade or for its components to separate. The FDA is responsible for providing guidelines for all manufacturers that package medications. Expiration dates are determined on the basis of tests conducted by manufacturers by the FDA. However, these rules do not apply to medications repackaged in a hospital setting for individual patient use. Once the medication is removed from its original packaging, the drug expiration date changes and the beyond use date is assigned to repackaged products according to the guidelines in the USP 795. The United States Pharmacopoeia, Compounding Non-Sterile Preparations, USP Chapter 795. You will hear us refer to it as USP 795 from here on out. There is an important distinction between expiration dates and beyond use dates. Expiration dates are assigned by the manufacturer. When reading a manufacturer's expiration date, such as 9/18, it means that the drug is effective through the last day of the month. In this case, September 2018. Beyond use dates are calculated by the pharmacy when repackaging or compounding medications. Assigning beyond use dates is an important process. Once a bulk bottle is opened and the medication is repackaged, the manufacturer's expiration date may no longer be valid. The beyond use date of a repackaged non-sterile solid or liquid dose is 1 year from the date repackaged or the expiration date on the manufacturer's container, whichever is earlier, unless otherwise stated in the manufacturer's literature. So example 11.1 is beyond use dating. So acetaminophen 500 milligram tablets. Today's date is August 15, 2018. Per the manufacturer, the medication expires in December 2020. Because the manufacturer's expiration date is more than 1 year away, you may give this drug a 1 year beyond use date of August 15th, 2019. Often patients need their medications packed in a 28 to 31 day card for ease of individual administration and accuracy of dosing. The method is often referred to as blister packing or bubble packing. The medications prescribed by a physician are put into individual pockets in a card that holds a month's worth of medication. Morning doses and night doses can be placed in different cards, and each dose is put in an individual pocket. This method has many advantages for patients and healthcare providers. For example, it makes compliance easier for patients in taking their medication correctly, and it allows timely monitoring by healthcare team members. Also, the unsteady hands of an elderly patient can get one tablet from the card without spilling the entire contents of a bottle or touching the other tablets in the card. If a dose is changed, and with long-term care patients, this is often the case due to their chronic or multiple disease states, the remaining uncontaminated medications in the card can be returned and reused. The card is a visible way to easily identify missed doses and to aid the patient in medication compliance. The art of compounding dates way back more than 4,000 years ago, beginning with medicinal mixtures using plants, animals, and minerals. Historians have found recipes for various treatments written on scrolls from 1500 BC and mortars and pestles have been unearthed that were used in the early Egyptian and Roman societies. In the United States, the first pharmacopoeia was published in 1820 and listed more than 80% of the prescriptions that were made. All were compounded products at that time. So that's what I was kind of talking about in the beginning. As the pharmaceutical business grew, more drugs are manufactured in common dosage forms by drug companies, which reduced the number of products that needed to be compounded by the pharmacy. It was not until the late 1990s that compounding once again became popular. Pre-made doses are not always appropriate for everyone. Each person is different because of the other concurrent conditions or physiological factors that affect the drug prescribed. This is evident in pediatrics, where dosages may be calculated and provided based on the weight of the child because of the metabolic rate of children is quite different from those of adults. Hospice patients who may not be able to swallow oral medications or have injections require a different dosage form that is not available by a manufacturer. Box 11.1 lists why compound medications. So the medication is no longer made, the patient is allergic to a preservative or dye, and you can read the rest of those. Non-sterile compounding consists of compounding 2 or more medications in a non-sterile environment. Aseptic technique, which is sterile compounding, is discussed in depth in Chapter 12. Most community pharmacies do not have the staff, the wide variety of supplies, or the time to compound various dosage forms and medication strengths. The FDA requires that non-sterile compounded products meet the United States Pharmacopoeia National Formulary USPNF standards, although they do not specifically regulate compounding. Compounding pharmacies must follow each state's Board of Pharmacy regulations in addition to USPNF standards. And box 11.2 shows examples of dosage forms that can be compounded. So topical agents, oral liquids, oral solids, suppositories. The USP 795 guidelines for determining beyond use dating for non-sterile compounding are shown in this table 11.5. According to the USP 795, a non-sterile compound has three main parts: the active ingredient, medication, or active pharmaceutical ingredient, the inactive ingredient in the diluent or vehicle. So here are the guidelines. So for non-aqueous formulations, meaning no water formulations, the BUD is not later than the time remaining until the earliest expiration date of any API, which is an active pharmaceutical ingredient, or 6 months. Water containing oral formulations, the BUD is not later than 14 days when stored at controlled cold temperatures. Water containing topical, dermal, and mucosal liquid formulations, the BUD is not later than 30 days. So if it's something contains water and it's going to be used orally, it's only good for 14 days. If something contains water and it's used topically, it's good for 30 days. And then all other products, non-water formulations, can be good for up to 6 months or until the earliest expiration date. Certain criteria established by USP 795 must be met in setting up a compounding area. The compounding area should be away from areas where normal prescription processing, chemicals, dust, or open boxes are located. Types of equipment used in compounding are personal protective equipment, weighing devices, measuring devices, and an assortment of containers and labels. The minimum required equipment list is provided by each state board of pharmacy. Although pharmacies may want to stock additional types of equipment for preparing products, this determination normally is made on the basis of the amounts and types of non-sterile products the pharmacy provides. The maintenance, calibration, and cleaning of each piece of equipment is required according to that manufacturer's specifications, and documentation in the form of logs is required by 795, USP 795. Table 11.6 shows examples of compounding equipment. A lot of these you will have in your lab kit, so you might have already seen them. Preparations of non-sterile compounds include weighing of powders such as hazardous powders like testosterone occur within the hood as the controlled airflow keeps the operator from inhaling the products. Graduated cylinders are available in various sizes from 1 ml to 1 liter. The types are either glass or plastic, and the shapes are either conical or cylinder. They are used to measure liquids. Other types of measuring instruments can range from syringes for small volumes and pipettes for minute volumes to large automated measuring machines. These electronic machines, ointment mills, and capsule filling machines are used in compounding pharmacies to prepare large amounts of medications. Capsule filling machines normally fill 100 to 300 capsules at a time. So here's the difference between a cylindrical and a conical graduated cylinder. For the conical, it should be used, so it's a wider platform, it's more stable when measuring viscous liquids and makes it easier to mix solutions. However, because the sides are flared outward, reading meniscus is more difficult, which affects accuracy of measurement. For the cylindrical, you should use to measure liquids more accurately. Glass is used for hot liquids or liquids not compatible with plastic devices, and plastic is used for cold liquids. Various sizes of glass and porcelain mortars and pestles are necessary depending on types of ingredients to be prepared. Various spatulas include metal and plastic. Automated mortars and pestles used for ointments and creams have settings for mixing times and speed. These allow the preparer to set up the machine for a time to mix according to a formulation, compound, or recipe. So table 11.8 goes over that again, the different kind of equipment and why and where to use it at. So for the glass mortar and pestle, it should be used for preparing liquids such as solutions and suspensions, and for mixing oily or staining materials. For the porcelain, it should be used for blending powders and pulverizing soft aggregates or crystals. So here's a 3-roll ointment mill. This is an electronic mortar and pestle A. And this is where you can choose the settings. A class 3 balance, also called a class A balance, is a torsion balance. This type of scale allows a counterbalance to determine the weight of the substance being measured and is referred to as a mechanical scale. This type of scale has special weights that are labeled in a range of milligrams and grams. The minimum weighable quantity for a class A balance is 120 milligrams. Weights used on this type of scale should be stored in a hard shell container and should be handled only with the accompanying tweezers. Various suppository molds can be used to prepare suppositories. These include the traditional metal molds, in which cavity openings range from 1 to 2.5 grams. Different mold sizes allow for different numbers of suppositories to be prepared. The molds are held together by nuts and screws while the ingredients solidify. Another option is hard rubber molds, which are similar to the metal molds. Hard rubber molds are held together by screws that are loosened when the suppositories are solid. Excipients are inert, which are non-medicinally active ingredients that are added to preparations to achieve the required consistency, effectiveness, and functional properties to form a suitable dosage form for administration. So table 11.9 shows the different common additives. So we have coatings, disintegrants, emulsifying agents that maintain dispersion of finely divided liquid droplets in a liquid vehicle. Made from 2 or more immiscible liquids like water and oil, and can be a liquid or semi-solid. Flavorings are often added to medications to mask the bad taste of the ingredient. The tongue recognizes 4 basic tastes: sweet, sour, salty, and bitter. Masking the taste becomes more difficult as the distaste increases. Flavorings such as saccharin impart a bitter taste followed by a sweet taste, whereas sucrose gives an immediate sweet taste. So we have in this chart 11.10 common flavoring additives for taste. So as you guys probably know, or have taken before in your lifetime, a antibiotic like amoxicillin, that's the pink liquid. Well, it used to be pink. Now I think a lot of places are doing it without the dye, but they have a flavor already in them. Whether or not it's really good or not, I don't know, but there is a flavor in them. But at places, at least when I worked at Walgreens before, it's been a few years since I worked there, but they had a flavoring like kit where they could just flavor pretty much anything, and they knew what was good to go into what. So here for antibiotics, it says it should be citrus, cherry, pineapple, orange, berry, banana, strawberry, vanilla, banana, vanilla, lemon, custard, or fruit cinnamon. And then you can kind of see the rest of them here. Before beginning the compounding process, the technician should tie back long hair and put on a lab coat and gloves to reduce contamination of the product. In addition to these personal considerations, a technician who is sick or has any open wounds should not compound any products. So here is the technician competencies for compounding. You can read through that. When using a Class A balance, begin by gathering the necessary ingredients and supplies, such as glycerin paper or weighing boats and weights. The balance has adjustable legs for leveling it on the compounding surface if necessary. Each balance also has an arrest knob that is used to lock the scale in place, which reduces the possibility of damage to the balance. The proper setup of a balance includes 6 steps. So here are the 6 steps. There's 8, but I think some of them are just like turn the knob on type and then turn it off type things. Always place the weights on the right side of the balance using a weighing boat or paper. This is done to ensure continuity of measurement. When reading the calibrations of a beaker or graduated cylinder, you must have the liquid at eye level. You must read the graduated cylinder at the bottom of the liquid line, also known as the meniscus. So you can see right here, it kind of like almost dips. For maximum accuracy in measuring liquids, use the 20% rule. Measure no less than 20% of the capacity of any graduate. For example, a 100 ml graduated cylinder should be used to measure no less than 20 ml of liquid. Likewise, a 250 ml cylinder should be used to measure no less than 50 ml. In the case of small or extremely small amounts, a syringe or micro pipette is used. It would not be accurate to measure 1 ml of liquid in a 10 ml graduated cylinder because 20% of 10 ml is 2 ml, and this amount is much more accurate measured with a 3 ml syringe. When preparing solutions, you must understand the major parts of the liquid. The solvent is the vehicle used to dissolve something, and the solute is the ingredient or agent dissolved in the solvent. And the solution is the result. A drug solubility dictates the type of dosage form that must be prepared. For example, if the drug is water soluble, a syrup or solution can be prepared. However, if it is insoluble, an elixir, a suspension, or possibly an emulsion can be made. So box 11.4 shows solubility characteristics. The only type of compounding that may be done away from the compounding area is the reconstitution of pre-made oral suspension. So like what I was just talking about, like the amoxicillin or the Keflex. Reconstituting involves mixing a diluent, a liquid, into a powder to form a solution or suspension. These products are simple to prepare and do not need to be logged or labeled in the same manner as compounded products. And this you'll be doing probably several times a day. 11.1 shows the different auxiliary labels that will be placed on the containers and the dosage forms. Suspensions, we're always going to say shake well. That is the case for suspension eye drops, liquid suspensions. Suspensions are different from solutions because they mix a hydrophobic ingredient into a hydrophilic. So hydrophobic meaning not water soluble, and hydrophilic meaning water soluble solution. Tablets, capsules, and lozenges can be compounded by pharmacy technicians. Pharmacies can provide individual strengths and dosage forms to meet the needs of the patient. Molded tablets can be prepared using a tablet triturate mold. Compressed tablets are made using a pallet press or single punch tablet making machine. Box 11.5 shows table additives. Box 11.2 is calibrating the mold. 11.3, compounding procedure for molded tablets. To prepare tablets or lozenges, a single punch tablet press can be used to make one dose at a time, or a metal punch press can be used to make multiple doses. These presses are available in a variety of sizes to make various strengths of tablets or lozenges. Types of lozenges include hard or soft, and tablets can be chewable, effervescent, or disintegrating. The metal punch press is composed of two parts. The bottom has a small cavity in one end of the tube, and the top has a rod that pushes through the cavity. Various sizes of capsules are kept in stock for the compounding of encapsulated drugs. Advantages of capsules include masking of ingredients, taste, and ease of swallowing compared with tablets. After the proper proportions have been prepared, the powder is then blocked. With the steel spatula, the powder is gathered and compressed onto a flat surface, making it easier to fill the capsule using the punch method. The punch method is used when smaller quantities of capsules are prepared. Capsules are composed of vegetable base or gelatinous materials. Great care must be taken to load the capsule accurately. And table 11.12 shows the different capsule sizes. This. So we start off with 000 and go all the way up to 5. So 000 are actually the largest, and they can contain 100 or 1,000 milligrams. And the chart kind of goes down. So then the smallest is a 5, and that can hold 100 milligrams, and you can see that there. Troches, often called lozenges, are made by molding or compressing and have several advantages. They are normally made with flavors to enhance their taste. They also can be used as buccal tablets that are absorbed through the buccal lining of the mouth when the appropriate ingredients are used. Hard lozenges can be made into the traditional round shape or manufactured to look like a lollipop or sucker. Soft lozenges can be made relatively quickly and then colored and flavored. They can be chewed or dissolved in the mouth. Gummy type lozenges are primarily for children. The formulation consists of glycerinated gelatin and water. Fruit flavor is used to sweeten the ingredients and disguise the taste of glycerin, which is very acidic. Ointments, pastes, and creams have different consistencies depending on the amount of solids used. Pastes have more solids than ointments and creams. A cream is a semi-solid emulsion that is similar to an ointment, but it is cloudy instead of translucent. All three final forms have smooth consistencies. Medication sticks provide another way of administering medication. Agents such as antibiotics, local anesthetics, sunscreens, antivirals, and oncological drugs can be manufactured as medication sticks and applied directly to the site on the body that needs treatment. They can also be applied to certain epidermal sites for systemic effect, like affecting the whole body. For filling ointment jars, you should always use an appropriately sized container. They range from 1/4 ounce to 1 pound. So obviously you don't want to put a half pound or a half ounce in a pound jar, or 1/4, and so on and so forth. Ointment tubes are available in different sizes. Soft sticks can be clear or opaque. They spread the medication evenly when applied, soften at body temperature, and do not leave a residue on the skin after application. Hard sticks contain crystalline powders that are held together either by heat or by a binding agent. This type of stick must be moistened before it becomes active, and it leaves a white residue when applied. Several sizes and shapes of suppositories are used to administer medications to vaginal, rectal, and urethral areas. Suppositories are made with either solutions or ointments. They can be prepared in 3 ways: hand rolling, compression, and fusion molding. An oleaginous base, such as cocoa butter or a synthetic triglyceride, can be used because it remains solid at room and body temperature and melts at a warm temperature. However, care must be taken when heating suppositories made with cocoa butter. PEG polymers of glycerinated gelatins can be used in the manufacturing of suppositories. These types of ingredients dissolve in body fluids and are not as dependent on temperature. Glycerinated gelatins are often used for vaginal suppositories and have a wide range of additives such as zinc oxide and boric acid. If suppository molds are used, they must be kept at room temperature because the rapid cooling of refrigeration can cause the suppositories to break. The formulation should be poured into each mold cavity in a steady and consistent manner to prevent a layered appearance. Another way of preparing a few suppositories is to roll them by hand. For this method, cocoa butter is used as a base because it does not have to be melted. Triturate the grated cocoa butter along with the active ingredient in a mortar. Form a ball-like shape using the palm of your hand, then roll the suppository into a cylinder using a large spatula or a small flat board on a pill tile. The cylinder is cut into suppository segments, which are then rolled in one end to another to form a conical shape. Nasal preparations can be compounded as jellies, gels, ointments, solutions, or suspensions. They can be used for topical agents, as sprays, as inhalers, or as drops. Excipients used include buffers, preservatives, tonicity adjusting agents, gelling agents, and antioxidants, all of which must be non-irritating. These are the same types of agents that are used in ophthalmic formulations. They are quickly absorbed into the bloodstream for rapid onset of activity. So these are the common preservatives. And then it gives you the directions for preparing solutions. So we're not going to go over all of them. We'll go over the first one though. You can read through the rest. And if you have any questions, definitely reach out to me or your instructor. But for the preparing solutions, dissolve ingredients into 3/4 of the total amount of sterile water for the injection to be used. Mix well. QS, which is quantity sufficient, with SW, sterile water, to the total volume required. Determine the pH, clarity, and all other quality control factors from a sample of the solution. Filter through a sterile 0.2 micrometer filter into a sterile nasal container. Package and label. The types of containers used for compounded products must be appropriate. The container must protect the contents and have a child-resistant cap. The appropriate label and any auxiliary labels required. Once mixed to the proper concentration, all products are filled into the appropriately sized container. This should be done neatly to avoid waste. So here's the different container sealants and dosage forms. Syringes sometimes are used to prepare oral, vaginal, or parenteral compounds. Once the drug has been loaded into the barrel of the syringe, a cap is placed over the top to keep the contents inside. Several factors affect the stability of a drug. The amount of light and air, the temperature, and even the pH alter the longevity of a drug. Legally, the date given to a pharmacy prepared product cannot be longer than that for any of the ingredients in the product. The pharmacist or the pharmacy technician must find the appropriate beyond use date in the manufacturer's literature if it is not already provided. Although protocols vary between pharmacy settings, most compounding ingredients and steps are put into a recipe format known as the formulation record for the person preparing the medication. The FR includes a list of ingredients, the preparation methods, safety requirements, BUD information, and references for the preparer. In addition to the FR, pharmacies are required to have a CR compounding record or log sheet that is a record of finished compounds and includes all ingredients in the mix, the BUD assigned, the preparer, and assigned lot numbers. Also required are safety data sheets for all chemicals and drug substances, either in hard copy or as electronically accessible forms. However, if commercial products are used in preparing the medication, the package insert may be used. And this just shows a formulation record. 11.7 shows the box 11.7 shows the information necessary on compounding log sheets and medication labels. All chemicals should be safely stored inside cabinets or behind shelf brackets to avoid spillage. Several additives can be harmful if they are inhaled or come in contact with the skin or eyes. Every pharmacy has an SDS binder with information about all chemical products and how to handle spillage or contact. It is important to know where the SDS binder is kept in the pharmacy department. Cleaning up excess ingredients appropriately is important. The method of cleaning up and disposing of agents or any equipment used depends on the type of agents used. Hazardous chemicals must be discarded properly according to pharmacy protocol. Non-hazardous chemicals normally can be discarded in a regular trash container. Any glass or needles must be placed in a sharps container. Pharmaceutical elegance is the special use of a finishing technique to give the final product a professional look. Great care must be taken when topping off jars of creams and ointments. So you're going to hear pharmaceutical elegance a lot in your career. We want to make sure the labels are straight, that they can see all the information on the label, that it's not cutting off the top of their name, that it's not cloudy. We want to make sure that if we're putting creams or ointments in the jar. There's not creams all over there's not cream all over the side of it, stuff like that. The repackaging and compounding of pharmaceutical products is subject to regulatory control. The manner in which the medication is packaged affects both the product inside the package and the user's compliance with the physician's order for taking the medication. Many medications can degrade with ultraviolet light exposure. Therefore, they must be placed in amber color containers to protect the medication. Storage is another consideration for a prepared product in a specific type of container. All labeling requirements must be followed on the prescription, or the prescription is considered misbranded. Under the FDA Modernization Act of 1997, the following restrictions were placed on pharmacies. Compounded drugs may be made in limited quantities. Compounded products must be made from approved ingredients that meet manufacturing and safety standards. The drug product must not be identified by the FDA as a product that presents demonstrable difficulties for compounding in terms of safety or effectiveness. Many pet owners must medicate their animals. Administering oral medications to a pet can be difficult. Many delivery systems have been developed to avoid forcing a tablet down the throat of an animal. For example, dog treats can be made that have that medication mixed into the treat, and there's other sticks and transdermal routes. And this is all the stuff that is required for an animal prescription. And then table 11.14 shows pet dosage forms and uses. Pharmacy programs must include supportive personnel with adequate training to perform the necessary functions of compounding. To enable technicians to build and maintain a high skill level, training programs should be offered periodically. Instructions on compounding should include the following: calculations, compounding equipment, dosage forms, interpretation of symbols, literature, safety, and techniques. These programs may include watching instructional videos or observations and dialogue between instructor and personnel. The instruction should also include either a written test or a quality control test of finished preparations. The highest level of competency in compounding procedures is ensured if the pharmacies provide initial training followed by recurrent training in methods, regulations, and techniques of compounding. In this way, the pharmacy can provide the customer with the highest product quality. Many formulas are already documented in a compounding recipe book. However, in some situations, the final product may have to be prepared in a strength or volume different from that listed in the recipe, or products or different strengths that may be used to prepare a final percentage solution. In such cases, the pharmacist or technician must perform calculations to attain the correct weights and or volumes for the final product. So, of course, that involves math. And if you look down here, there's quite a bit. We're not going to go over it in this lecture video, but gives you kind of an example of what you'll be seeing.